Joining us. I'm going to start out with our land acknowledgements. We gather today on the ancestral homelands of the Coast Salish peoples who've lived in the Salish Sea Basin throughout the San Juan Islands and the North Cascades watershed from time immemorial. Please join me in expressing our deepest respect and gratitude for our Indigenous neighbors, the Lummi Nation, the Nooksack tribe, for their enduring care and protection of our shared lands and waterways. My name's Terry Bryant. I'm the chair of this group. I am the director of the Whatcom Homeless Service Center Department at Opportunity Council. And I invite you all to introduce yourselves in the chat. And if you're not already on our mailing list, please add your email. We'll be sure to get you added. Today, we have some presenters to discuss the pandemic response. And unfortunately, one of our speakers had to cancel. So that'll either leave more time for discussion or we might end early. So we'll just kind of wing it and see how it goes. I want to thank Ashley from Road to Home to talk about her experience managing the isolation and quarantine facility, and Hardeep Tiwana, hopefully I spelled that or I pronounced that right, to talk about vaccination efforts for the population we all serve on behalf of the health department. And with that, who would like to go first, Ashley or Hardeep?
I can go first. I'm going to go out and help also with the syringe program we have. So thank you for having me. Yeah, so the temporary vaccine logistical coordinator. And so our vaccine efforts really have started since like May, way before I started in 2021. And we honestly, up until now, have vaccinated a large number of our community members. It's approximately 6,390, but there's more. For people experiencing homelessness, we've had a regular presence with the Lighthouse Mission, our community partner, and at base camp. And so we've worked with providers like Sue Taylor to go and do those clinics. They're usually smaller, and we've had a good number of people, like 30 to about 15 that come. And our most recent one was, I believe, in February of this year. So since I started on my role as being like a point of contact for people experiencing homelessness for the vaccine efforts at the start of this year. Oh, sorry. Go ahead. Oh, okay. I thought somebody had a question, but all right. Zoom is great. So yeah, so I've started on since the new year of 2022, and since February, our most recent clinic at base camp. We are planning to do more clinics in May and June. So I have one for May 13 and another for June 3rd. And what we have found with serving the population is that it works well to have a regular presence and great communication with the community partners. So we're always there when they need us. And that we have worked with other health jurisdictions to see what works best in helping the community feel comfortable walking up to the clinic and receiving a vaccine. And we are working towards organizing some incentives so that can help empower people to receive the vaccine. And then, sorry, is Franklin, do you have a question? I'm so sorry. Okay. Sorry. It's like a teacher. I'm like, sorry, who's wondering? But anyways.
You're doing great. Thank you.
Okay, cool. Yeah. Anyway, so yeah, we're working towards organizing some incentives to help encourage the community. And we will have these clinics in May and June. And the frequency of our clinics have been declining because the demand has also been down, which follows a national trend as well. And so as we look towards doing fewer clinics moving forward, we hope when the Federal Emergency Management Agency, when that FEMA funding ends in June, I think the goal is in July to have our internal team of amazing nurses and staff go out to areas where there's a need and do our own clinics. Currently, we usually partner with a third party kind of providers who go out there and do the vaccines, and we provide like non-clinical support by setting it up and scheduling people and helping them. go through the process. And so that's what the vaccine efforts have been so far at the health department. I'm happy to answer any questions.
I have a few, so I think, oh, I'm sorry, I'm not going to speak first. I'm going to defer to Michael Lillquist. Go ahead.
Yeah, Hardeep, thanks for the information. Do we have estimates of the number of people at base camp who are homeless who are fully vaccinated and or even boosted? Are we at a level that's equal to the community, better than the community? What's it like?
I know when I've requested the numbers, which is hard to keep track of for with the providers we had, one thing that we noticed is we've at one point pushed for the J&J vaccine back in April largely with this community because there's difficulty, to perhaps have them come back again. And we know that now with the data and the recommendation is really the two-step series or really focusing on that. And so I would say that we are really trying to work towards doing like booster clinics where people come and get a booster so that their immunity is back at the level we hope to be. And we know generally, I think we've reached a lot of people, but they may not be as protected now because they received, majority of them received the J&J. And so we're hoping to go back and, from my understanding, go back and do booster clinics. But I don't have currently any numbers, unfortunately. I've reached out and asked for it, but I can get back to you on that. It's a great question.
Thanks. I was going to ask if there were plans for a booster clinic, so I'll go to my other question, which is, did anything surprise you in trying to launch or launching the vaccination clinics?
I think the large community support was a great reminder of who we were working with, because everybody was really willing to host clinics. Like even recently, we had one at a area for low-income housing, and we were next to a taco truck, and they were really willing to help us out and using their space during their time to do clinics. And so one of the, I think, things that keep reminding me is how great even the community is in supporting these efforts, because there have been people who have really been able to provide as much support as they can as we are there sometimes from 3 to 4 hours, helping the community get vaccinated.
Any other questions for Hardeep? Okay, then I'm going to ask another question. And what would you say was the greatest challenge in encouraging people to get vaccinated?
That's a great question. It's been a bit of a hesitancy and somewhat misinformation regarding the vaccines. And so as people are experiencing other life crises, it's harder also to think of their own health at times. And so we've found that by working with community partners and some LHJs have reported that instead of actively asking someone if they wanted to get one, if there's a way to have almost like just a presence where you're able to be there, like a tabling kind of event where you can answer questions and encourage people. And we know that one difficulty, I guess, is in that communication, because as we know, it's hard to, we can't just send it out some information like an email or anything like that, because that's been hard. And one of the quickest forms we've had was making ads on Facebook or flyers or calling people, even for that matter. And so it's been hard in that sense, but we know that if we do it with a community partner at a static site like base camp, it's usually word of mouth, like eventually it spreads. And that's one thing that we do continue to do.
Thank you. Any more questions? I'm just going to give it a minute to percolate. Franklin, did you have a question? If you wanted to ask a question, feel free to unmute yourself at any time and jump in, or if you want to use the raise hand option, that'll work too.
You can put in the chat, or I'll also give my email and get back to you on those numbers or any other questions that people have. So that way you have a means of contacting me. So I'll put that in the chat too.
Thanks, Hardeep. Really appreciate it. Thank you for being here and sharing that information. I know that with the population we serve, the priority of urgency is a little different when people are struggling to survive to get their basic needs met. And so it can be a bit of a challenge to encourage people to prioritize something like the vaccine when they're trying to figure out where to sleep or where to eat. So just thank you so much for those efforts. And I'm heartened to hear that there's a booster clinic coming. That is great news. Okay. If there's nothing more, I think we'll move on to Ashley. Ashley is the Executive Director of Road to Home, who took over management of the isolation and quarantine facility from, I think, the partnership between the Lighthouse Mission and Grace. Thank you so much for being here, Ashley. Would love to hear what your experience is like. And I'm probably going to ask you the same questions. What surprised you? What challenges did you encounter? Take it away.
Okay, well, thanks for having me. Yeah, I've kind of got a few thoughts collected, but feel free to drive the conversation or just kind of pull out what you want to hear. So we took over at the end of September and operating the isolation and quarantine facility out of Byron Street, which is the Motel 6 over off of Samish. And we operated that facility until it closed recently on March 31st. So we did a little over 6 months and served during our time about 260 individuals. I think the total count served by that program for the entire 2 years of operation is about 714 individuals. So during our time, we provided them with basic needs. We coordinated referrals from the hospital, from base camp, from other shelters in town and other service agencies to help safely isolate and quarantine individuals who didn't have anywhere else to do so safely. We provided basic food, 3 meals a day, and a pantry program, provided folks with hygiene supplies, did a lot of care coordination for medical needs or prescriptions, and just kind of tended to overall needs for folks while they're in isolation and distanced from friends and family and resources. We hired on about 7 staff. So we were providing, Road to Home managed the 24/7 operations of the facility. And so hired on a staff of about 7 to supervise and to provide basic needs to the individuals served. And then there was a staffing agency that provided services during the evening or overnight shifts, just because during a pandemic, staffing was really difficult. I think, universally, I think we can all agree on that. And so it was really helpful to have this agency come in and just be solely responsible for staffing that overnight shift. And so in partnership, the health department, ourselves, Aristo, and then several contractors in town, we were able to provide those basic needs, which included like laundry services, linen exchange. Maple Alley Inn provided them the food, the amazing food. They do such a great job. And so it was really just a partnership. And, I think some of the questions were that you listed, Terry, was challenges that we faced. Is it okay to just kind of transition into that? Okay. There were lots of challenges, but I suspect it's specific to how COVID affected our work. And, everyone that we serve is in a different life circumstance. And so with serving them and their diagnosis of COVID also came with helping with some of the other pieces of their life that sort of had to come with them. And so we spent a lot of time trying to to help with some of those nuances with people and relationships and pets and things like that. So that just took a lot of time, something we weren't initially prepared for, but adapted to in our role in serving the individuals that we did. You know, bandwidth is always a challenge with COVID right now. Just learning how these people need to be supported, how our guests needed to be supported, how the staff needed to be supported, and how to figure out how to work together and what the needs were, even across agencies and contract holders, was tricky because there were things that weren't super clear. You know, when it comes to COVID, what is medical and what isn't seems like a really clear line, but sometimes it's not. So, and that kind of leads into the second piece, is just having enough medical support. COVID as a diagnosis in its severe form requires medical support sometimes, but can be managed without the need of medical support. But there was this in-between line that we were you know, having to figure out and navigate as a non-medical facility in serving these individuals and making sure that they're safely sheltered and getting what they needed, was definitely something that we had to work with and constantly learn how to respond to. So, yeah. Did that cover some of the general overview? I'm totally open to questions and wherever you want me to take the conversation.
Well, I encourage everyone to ask questions, but I have one I'll just kick it off with. And that is, I was involved somewhat in the really early conversations about the IQF. We weren't even calling it that. We were calling it something else. But the premise was, this is a place for anyone who can't safely isolate to go, and meaning not necessarily exclusively for people experiencing homelessness. So I'm wondering, now that it's all said and done, what percentage would you say were homeless and which just didn't have a safe place to isolate?
I don't know if I can give you a percentage. One, because, you know, I didn't get to meet every face that came through. And two, because we took over operations, you know, the last quarter of the program. I would say, you know, a handful in comparison. I think we definitely had individuals who fit the scenario where they had a roommate who was incredibly vulnerable and it wasn't safe to isolate or quarantine with them because of risk of exposure and how their roommate may have handled COVID-19. There were individuals who were doubled up or had you know, large families in the home where people didn't necessarily have their own room. And so it wasn't safe to isolate or quarantine in those homes. There, you know, similar instance with a vulnerable individual, there were small children or infants in the home and it just wasn't safe. We also saw partners, like married couples and children in some instances where it just wasn't safe for whatever reason to isolate and quarantine together. So there, I mean, we absolutely served a population outside of individuals experiencing homelessness, but majority of our population was those who just didn't have anywhere to safely isolate or quarantine. And I will say that, you know, we ended up being a landing pad for individuals who really had nowhere to go, even within some of the other service agencies in town, like the hospital was a huge partner and we were a huge resource for them, just because sometimes they had medically complex individuals or people who really couldn't manage what they were experiencing on the streets. And COVID really gave those individuals a safe place. I mean, it's hard to see it in a positive light, but because they fit the criteria of COVID, they had a safe space to shelter and to be connected to resources and have somebody checking in on them. And so being as low barrier as we were was, I think, critical to our community during that time. And it was nice to be able to offer that.
I'm going to read a question that Vaughn put in the chat, and that's, how many of the folks who had been at the facility at the time of closing had a set place to go afterward?
That's a good question. So we actually didn't have anyone in the facility when it closed. Because, transmission rates dropped so low in our community. Our last person discharged about 5 days, I want to say, before the end of our contract and before we had to be out of the facility. So luckily we didn't have to carry over anyone or try to make arrangements for anyone sort of caught in between. So thankfully that wasn't an issue. I will say I don't know if folks are aware, but there is a new model that has opened up, which Road to Home has continued a contract with the health department to provide some sort of isolation only services. And we, effective today, we're open for admissions. And so we have a small section of a hotel that we can provide hotel rooms to individuals who've been diagnosed with COVID and have nowhere else to isolate. So we are able to continue that service for folks who do end up needing similar services as we go into the next few months and potential surges and variants.
I have more questions unless others do.
I have one.
Go for it.
Thank you. Actually, I'm curious about your staffing model. It seems like with the surges, the need and the population there would go up and down pretty abruptly. How, from a logistics perspective, how do you manage that?
That's a good question. I can share my experience. I don't think there's one way to do it. We were very fortunate. I think that's as simply put as I can state. We had a base, a foundation of staff, and quite frankly, the staffing agency that filled in that night shift were sending people during the day when we surged. We, obviously experienced the Omicron surge. We saw that ticking up prior to Christmas, and our capacity, we were at capacity during that surge. And it was all hands on deck, as you can imagine. So we brought in staffing agency, and then I hired people in the middle of the surge to come in and add extra support. We actually also figured out our sweet spot for staffing probably about end of January, early February, just in time to close down the facility. And that was actually to build in another support. We realized with a facility this as large as Motel 6, that there were so many logistical pieces to manage, not just guest support and guest needs, but the facility itself was a huge barrier in our ability to serve the community just because of the state of the facility itself, plumbing issues, room maintenance and needs, just a lot of unforeseeable things that popped up. And so we finally figured out that we actually just needed another layer of support to manage the facility part of things, and then flex to filling in for the staff on site who are working the shifts and working with guests directly. So it evolved over time. But my approach to staffing in general, especially for something such as a facility that whose needs vary based on census, was to just bring in people who had flexible schedules and staff people in a way that they complement each other, so that if there were needs across the week where they needed to trade or had excess hours available to work pickup shifts, I wasn't burning out all of my staff. So it's kind of multifaceted, but yeah, I would say critically having that staffing agency was supportive at the time. But we certainly learned how to prepare for a response without that need after the surge. Did that answer your question, Chris?
I'm going to ask questions until I run out of questions, but if anyone wants to jump in, please do, because my question shouldn't be the priority here, should be yours. How did you manage things like laundry and transferring meals between guests who are staying there, and also minimizing the risk of cross-contamination?
So the systems that were set up, let's see, I'll do laundry first. So there were, so there's personal laundry and then there were linens. And so personal laundry, we had a system where an organization was contracted with the health department to provide laundering services. And so they had certain bags they wanted us to use. We would label them with room numbers. We would have the guests bag their own laundry first, put it outside of their doors, and then we would rebag it in a non-contaminated bag. Like I said, label that and then store it in a location for the service to come and pick it up. And then they would return it with with a fresh bag, obviously, and the room numbers labeled on them. So it was a fine-tuned machine by the time we came in. And then for linen, a similar situation in that the contracted company to clean the rooms would bag the linen, and then another service would come and pick that up regularly and then deliver fresh linens to us. Regarding food, so that was an interesting system. So Maple Alley Inn provided us 3 meal drop-offs per week. It was enough food to last for 3 or 4 meals. And so we would deliver the food bags to guests outside of their rooms. It was like a drop and dash, or we'd call them on the phone and connect with them directly. And they would everybody had a microwave, a mini fridge, things like that in their room so they could heat up the food. We had all of the utensils and paper plates and things they needed to eat off of. And so that was the ongoing system for food throughout the day or throughout the week. We did provide breakfast every day, a set number of food options for that they would request each day based on how they were feeling. And then we had a pantry system set up that would supplement the 3 meals a day that we provided, where they could get snacks and things that weren't provided to them on a daily basis, but that they could use a credit to purchase, things that they would probably, go to the gas station for, but to kind of keep folks feeling satisfied with some of that snacky food or things that just were comforting when you're isolating in your room by yourself. So yeah, and then actually we had donations from the community on Sundays. So the Maple Alley Inn provided food 6 days of the week, and then Sundays both Little Caesars and McDonald's donated food, and so we were able to kind of offer that as a nice treat at the end of the week. I know not the best food when folks are isolating and should be eating healthy, but it's about comfort, and it's about getting folks to feel okay in the space that we're providing for them to isolate safely and prevent the spread. So it worked, and people were really happy about the food. They were really impressed with the quality and what we offered. So those were the systems we had for linen and food.
Juan has a question in the chat, and that is, was funding readily available to address those maintenance issues?
Yeah, so the county assumed responsibility for the facility. So if there were maintenance issues, the county would send out either county facilities individuals or contracted with a maintenance provider to go in and repair and do what they needed to do.
I'm going to ask you another question, and that's, did you have any issue with guests either wanting to socialize with each other or outside guests wanting to come into the facility? And if so, how did you manage that?
Yes, and yes. So naturally, folks want to socialize and interact with each other. And sometimes people knew each other. It was a little bit of policing and encouraging people to not go into other people's rooms or to maintain distance, make sure they're wearing their masks. I think overall people were really understanding and cooperative in that respect. it was harder when the facility was more full, right? Because people are door to door to each other, so they're going to run into each other and see each other. But we did everything we could to manage the gathering and prevent folks from coming down in groups. So we tried not to that's why there was no serving of meals where people kind of come down and get their food together. The drop and dash method worked really well for that, so that we were providing supplies directly to their door and not asking them to gather. And then regarding individuals trying to come in, it was allowed for folks to come to the gate, to the fence, and communicate and see their friends and family. So when it came to friends and family visiting, we didn't have any issues folks trying to come in. We didn't experience it, but I think early on the team who was working experienced people thinking it was still a Motel 6 and coming in and trying to get a room for the night, which I think was really challenging for them, because they're like, no, you need to leave, like you can't be here. Luckily they had done all that hard work for us, and we didn't really experience that during our time operating the facility. Occasionally we had to enforce folks staying out of the facility. And it was mostly around like dropping things off for guests and just trying to maintain protocols to prevent, the spreading, the virus spreading. And so people were generally pretty understanding. Yeah.
Ina has a question in the chat, and it is, for about what percentage of the period that Road to Home managed the facility essentially at or close to capacity?
I can't give you a percentage, but only during the time of the Omicron surge. So when we took over, I think it was after the first, or the second variant surge, and it was pretty slow for a while. We had 10 or under for most of the time up until early to mid-December, when Omicron started surging. And then it stayed pretty busy, and we were only at capacity for a brief time, that end of December into like early January, we were pretty full. And then numbers dropped, and we were at 20 to 30 for a few weeks, even after the initial peak of the surge. And then we saw the numbers start dwindling into March.
Michael has a
And then
question. Oh, I'm sorry. I thought you were done.
I was just going to comment on it.
Oh, go ahead.
So the question was, what was the average stay or typical length of stay? I can't tell you overall what the average length of stay was definitively, because we kind of calculated it month by month. But folks stayed right between 10 and 14 days. Some folks ended up being there 21 days. Some folks were there less than the 10 to 14 days, just depending on the symptom onset. And then, sometimes on a very rare occasion, there was like a discharge delay where somebody was going into a treatment facility and just needed one more day. So, that was generally pretty rare and circumstantial, but on average, folks were there for their 10 to 14 days. It was in that window for most folks. Michael, did that answer your question? Okay. Sorry, I don't have a firm number for you.
I'm going to ask another question. I'm really full of them today. What's the referral path to the secondary location that you're able to manage going forward?
Yeah, so referrals will be sent, let's see. I think so. Before the health department was a little more involved in the referral process. If you were like a designated referring partner, then you had to go through the health department. I think they're trying to move away from that. And I think people would just contact Road to Home directly. And so I'll put the email in the chat for the supervisor email who would receive referrals. In the process for that, there's a set of paperwork that you would complete, just indicating the individual's test date. I think, it has to be positive. So we're doing just the isolation only, no exposures. And just some basic information about the individual. They have to agree, they have to voluntarily consent to come to the facility and enroll in the program and abide by the code of conduct. And then what would happen is a screening conversation would happen with the supervisor and the referring partner over the phone, just to initially screen and make sure they qualify for the new model of care, because there are more criteria for enrollment into this second program. And then what would happen is our supervisor, case manager, would actually go out and then interview the individual to ensure that they're understanding what they're volunteering to participate in, and make sure they're fully aware of how to get their needs met and what to expect at the facility. And so I'll put that in the chat right now. And I can put the phone number as well. There's a phone that the supervisors, case managers hold on to during the day. We are only in office during the daytime shift and accept referrals between 9 a.m. and 3 p.m. So I'll put all that in the chat.
Thanks, Ashley. Any other questions? Because I have more, but I won't get crazy.
I'll chime in. I got a quick one, I think. Were there folks that stayed there on more than one occasion?
Yes. And I do know that later on in the pandemic, requirements changed about whether or not people had to isolate a second time. And I want to say that sort of changed while we were operating, because initially we accepted people and then got word, actually, oh, they were just there, they don't have to be there again. But yes, we absolutely saw people who returned.
I have two questions. One is, did you figure out kind of a ratio of staff to number of guests? And then my other question is related to an earlier one, and that is, in this new facility, I'm assuming that there's people who don't have COVID staying there too. How will you manage that cross-contamination potential?
Yeah. So staffing ratio. It's tricky because some folks really required more time and more staff resources, because we ended up taking in individuals who were more medically complex. There was a lot more care coordination that was needed. And so we were, one of my poor supervisors, she is such a go-getter and she can get a yes out of anyone. And so she was on the phone with every pharmacy in town and trying to get the right medication for individuals, and had to sometimes send the communications back to the doctor's office to get the prescription, renewed. And so, that was the reality. Some days were spent chasing prescriptions. And then, when we were surging, our biggest priority is making sure everyone was safe and okay, and that we were managing symptoms and staying on top of those changes if there were some symptom like increases or new developments. And so I'd say, for us, a rough ratio was 2 staff for up to about 20 people, because one person is tending to the needs of individuals and one person was doing all of the care coordination, coordinating future referrals, coordinating discharges, and then managing the facilities, the needs, coordinating food drop-offs and linen and things like that. So at base, that was about the ratio before we needed to bring in another person to help support. And then the second question was about preventing cross-contamination and spread. Is that right? Okay. So at the hotel that we are utilizing for this extension of the contract, we have a floor of the hotel that isn't highly utilized. And so we have a section or a block of rooms that are only going to be used for isolation purposes. And what we were told is that they're really not going to have anybody utilize the third floor if they can help it. I think if we had all of our rooms full, there would have to be a conversation about blocking off part of the hallway or doing some sort of infection control efforts. But as it stands right now, that's not an issue. We have a stairwell dedicated exclusively to our residents, our guests, and there's an elevator that we can use that minimally interferes with the rest of the facility. And then all of our guests will come and go through a side door, not going through the main entrance. We'll be firmly enforcing universal mask wearing anytime folks are outside of their rooms, things like that. Because we no longer have a hallway to the outdoors, we have to be really mindful about just the potential for infecting other people. And so to protect the staff and then of course other guests or staff that are coming and going between the hallways or the floors, most all of our interactions are going to be a little more virtual, just because congregating in the hallway isn't going to be the safest interaction. And so as much as we can defer to the phone, we will, though face-to-face interactions may still be required, in the event of emergency or just to check on folks for symptoms. But that's what we're going to try to emphasize initially, to make sure that our staff are safe and that we can continue to staff the program. So does that answer your question, Terry?
Yes, and I'm going to ask one more, and then I will stop riddling you with this interrogation here.
I don't mind.
You touched on the referral path as directly to road to home, but can someone refer, or can provide, can a service provider refer? Does it have to be a medical service provider?
Individuals have self-referred in the past. What we've done is we've asked them to connect with the does a little more investigating about symptom onset and things like that. I think I'm going to have to ask to see how involved they will be in the referral process moving forward. We just finished getting into the facility and setting up within the past 24 hours. Like, we've been working and getting set up, so we haven't been fully operational yet. But if people reach out to us directly, we can certainly make sure that they're talking to the right people. If it's not us, to make sure that they go through the right avenues. And then, I want to say that, yeah, I'm going to have to find out what the health department prefers. If it's not a designated referring partner currently, I'll find out and let you know, Terry, so you can disseminate it to the group about whether or not folks can just refer directly to us from any agency and self-refer, or if they need to go through the health department. So I'll find out for you.
Thanks. For the time being, for this group, if someone has a client they're concerned about, should they just call you and talk through the process?
Yeah.
Okay.
Yeah, absolutely.
And that's in the chat. I didn't notice if anyone here is on the phone exclusively, but I think just to be safe, I'm going to read out your contact information, which the phone number is 360-594-1161. Referrals are Mondays through Fridays from 9 a.m. to 3 p.m. And the email is iqfsupervisor@road2home.org. Not the word number, just road2home.org. Ashley, thanks for being patient with all my curiosity, and I'm just going to be transparent that I have an ulterior motive, and I want to learn as much as I can before we embark on providing respiratory care at the way station. So you'll probably hear from me again.
Absolutely.
Anytime. And thanks so much for all your org does to serve this population. It's just very appreciated that you always step forward. Thank you.
Thank you.
Any other questions? Okay, we'll move on with the agenda here. And the next item is an update from the steering committee for the coalition. The steering committee wanted to take some action, and one of the areas they felt was worthwhile to discuss was our community's ongoing efforts to provide severe weather sheltering. And that can be a really broad topic, as we discovered when we first convened. So we have kind of a small subcommittee of folks that meet and discuss this. So there's some really experienced people who are participating. I'm looking at Hannah. She doesn't know, but Hannah Hartman has experience doing this kind of shelter extensively and provided some materials for us to review. And the conversation in light of the weather, the flooding, the summer smoke, like how broad and how narrow is realistic. And the group decided that really all of it is needed, but we really need to narrow down on something that is actionable. And so choosing to focus on extreme cold. So we've been meeting to talk about that. But meanwhile, while we're meeting, the county and the city are both working on the same thing. So I just want to, and I'm sure Chris will talk about this in the county update, but the county is working to launch a request for proposals, an RFP, for organizations who are interested in providing severe weather sheltering, you know, in the next winter season. And that's coming out this month, later this month. And the city has worked pretty hard to really develop a comprehensive operations plan, how to provide some daytime warming services. So if it's okay, Katie Sullivan, would you mind talking a little bit about that? You've done a ton of work in that regard. If you'd share that out, it would be great.
Yeah, sure. Thank you, Terry, for kind of that context. I kind of want to speak about the planning work kind of from a broader perspective, but also speak a little bit as to kind of the genesis of the warming center and why kind of the city's plans for the warming center kind of mobilized the way that they did. So I guess a little bit of background on kind of this work. So going into the winter season, initially the city didn't have plans to open and operate a severe weather warming center. You know, typically we at the city don't operate shelters. Really, typically our role in the system is to fund community partners in their work to provide services and shelter to those who need it. So the city strategy going into the winter season was really, and our understanding was really that there are resources available to serve individuals experiencing homelessness in the event of severe weather. And our strategy was to lean on these community partners to provide that coverage in the event of severe weather. You know, looking at the landscape, our community had Christ the King expanding their overflow shelter to help support the capacity limitations at base camp. They were going to be open for 5 months this winter season, as opposed to 3 months, which has been the case in previous years. We had also gotten approval from our council to fund the operations of a drop-in shelter operated by Northwest Youth Services, and for up to 25 young adults. And we also knew that Ferndale had plans to open up an emergency shelter, severe weather shelter, in the event of a severe weather emergency. So that was, so going into the winter season, since the overflow facility had opened up in mid-October, none of the emergency drop-in shelter providers had been precariously close to reaching capacity. So our strategy was really to lean on these partners. So that was the strategy we're moving forward with. And then kind of the cold weather spell that our community experienced at the end of December came to pass, and folks at the city really went into emergency management mode. It was then that our mayor made the decision to stand up an emergency daytime warming center. And this warming center that was stood up was mobilized across multiple days the last week of December. and it was really operated on the fly. The center had an anchor staff of volunteers who worked at the site over multiple days. There was virtually no operational planning that was put in place for the center. And at the end of the cold spell, the volunteers who had worked at the warming center reported back that it was a useful intervention for individuals who may have been trespassed or couldn't access kind of our existing emergency drop-in centers, and that this warming center that the city stood up provided a really necessary service to individuals who otherwise might not have had a place to go. So after this cold spell, after that warming center was stood up, it became apparent that we at the city needed to pivot our strategy and include a plan to open a severe weather warming center in the event of severe weather in the future winter months. So from there, once that decision was made, the ownership of the operation shifted from the administrative side of the city and the mayor's office over to my division, the Department of City Planning and Community Development. Once we in community development had ownership of the program, we could get to work on planning all of the different details that go into standing up an emergency intervention like this. So I guess speaking a bit to the planning of the space, the first item that we tackled was identifying an appropriate space for this program. The library lecture room made sense for this type of intervention because the lecture room, which is normally booked solid to accommodate programming, was closed to community partners because of COVID. I don't know if the library lecture room would make sense for this type of intervention in the future because it doesn't have air conditioning. So I don't, in the event of extreme heat, but that's a later discussion. But it was determined to be an appropriate space for this program. The second task at hand was developing an operations plan to outline what the protocol would be to mobilize the space and place it in service. For the purposes to activate the space, we use the same guiding assumptions that Whatcom County utilized to activate their overnight operations. The thinking there was then there would be continuity across the spaces, and essentially the guiding assumptions outline that the space would be placed in operation if the temperatures reached a threshold of 28 degrees. There was also precipitation and kind of wind factors that went into compelling that decision. For staffing the operation, we used a volunteer model that had propped up the warming center at the end of the year. So we utilized a lot of the volunteers who had stepped up at the end of the year to run the warming center and recruited additional volunteers through volunteer networks maintained through a variety of different channels, the BPD, community initiative networks, including CAST and local religious groups. For training the volunteers, we really had to rely a lot on our community partners to lend their expertise. You know, we at the city have a lot of experience in contract management and policy analysis and community planning, but collectively, we don't really have a lot of experience and knowledge in standing up and staffing an emergency shelter intervention. So through the support and shout out to Terry and Marisa and their teams, we were able to support our volunteers and provide de-escalation training and other broader theme training to our volunteers, including boundary setting, guidance, tips for enforcing COVID-19 protocol through both a pre-recorded hot team training and through Nietzsche Academy, which is, for folks who aren't familiar, it's an e-learning platform that offers a number of different social service related training tools online. Additionally, we connected some of our volunteers to our community paramedic who outlined best practices on handling any medical issues that may have transpired on site. Once our volunteers were trained, we turned our attention to more of the administrative elements of propping up an operation like this. Things like developing various center policies and identifying and procuring supplies that we needed to run the center effectively. We also cross-coordinated with the hot team to support the operations of the center should the center ever be put into effect. So what this means is that we didn't really expect our volunteers who would be working at the center to have that expertise or that lived experience or that lived knowledge to make referrals to the various housing and supportive services agencies offered in this community. So we really leaned on the HOT team to be available to provide the support to guests and provide referrals to shelters and other services and de-escalation support if necessary. We also plan to lean on the HOT team to really lead the volunteers on site when the center, should the center ever be activated, and manage the room and ensure that guests followed the outlined code of conduct policies for the operation. We had also planned to support the HOT team by having one high-level city official on site at all times to be on call in the event that volunteers ever needed de-escalation support, support folks if there was ever an escalated medical event, and 911 had to be dispatched to the site, and respond to any like press inquiries or advocate inquiries that should transpire on site. So what did this operation look like when placed into practice? So we actually don't know. The temperature never necessitated the operation to be mobilized and placed into service. So I can't really speak to any of the lessons learned as far as what was beneficial to carry over into other severe weather operations and what challenges would need to be addressed in future programs. But it wasn't all for nothing. I think the hope here is that a lot of this planning work can be utilized for future severe weather interventions that the city plans and provide kind of that rough framework for how to proceed in the event of another severe weather emergency. Some changes I would like to see for future severe weather options. I don't know if it's possible, but I think we've spoken about how we would like to see more of a move away from a volunteer staffed model. I think when we talk about the individuals who need to be kind of served through this kind of model and their needs, the population has a high degree of needs and needs a high degree of support from the staff they're interacting with. And I am really grateful to the network of volunteers that we recruited and who offered to perform this labor for free. But I don't necessarily know if this network has the experience necessarily to kind of meet those needs and provide that level of service and support. Another change that we'd like to see in future planning operations is, again, this operation that was stood up at the end of the year was really an ad hoc planning effort. So there wasn't as much intentionality as I would have liked around procuring supplies or developing maybe the best set of policies around how to address medical issues that may have transpired on site or COVID-19 protocols to enforce. So hopefully we can really think through this in future operations and identify best practices that make sense here and vet those with folks who, you know, may actually have kind of that experience in setting up an operation and operating a program like this. So yeah, I think there is a lot of room for improvement. I think that the fact that the warming center was stood up at the end of the year is a feat, considering that that wasn't necessarily the strategy going into the season. And the fact that the city was able to pivot and open up something quickly, I think is worth noting. I think a key lesson learned in this process is that the city might not be the most equipped to actually operationalize and institute this programming. I think ideally in a perfect future, a program like this would be stood up and operated by a third-party operator. Ideally, a community partner with experience in setting up and operating an emergency drop-in shelter, and the city would fund this effort. But we'll see if there's any community interest there. Until then, we have a basic framework in place for future severe weather emergencies and future severe weather centers. And we're, of course, open to all feedback and eager for any and all community suggestions about how to improve our efforts and our planning. Again, I don't know if it was a perfect planning process, but we were really grateful for an enthusiastic and really dedicated pool of volunteers and really, really generous community partners who helped shape navigate the planning process.
Thanks so much, Katie. I just want to mention that Vaughn was asking about the training course. So also the trainer is Ryan Dowd. He's very personable and digestible. I don't know if that's the right kind of word, but it's really an engaging training. And if you can't access the chat, you can look into Ryan Dowd with a librarian's guide to homelessness at www.homelesslibrary.com. And then Doug has a question. Who staffed the site at the center? You touched on that somewhat. Sounds like it was primarily volunteers, but I'll go ahead and let you answer, Katie.
That's correct. It was primarily volunteers, as well as some city staff members. The mayor was actually there for a few days at the end of the year, some council members. So it was primarily a core group of volunteers and city staff members.
Thanks, Katie. So that is really helpful. So Michael, go ahead and ask your question.
Hey, Katie, thanks for doing all that work for us. So as you say, this was ad hoc. It'd be nice if it wasn't so ad hoc in the future. I think I agree with you completely that ideally the city, we're a funding agency, and that if we could find a partner and stand them up financially and grow that capacity, like in so many things we're trying to do, right? I think it would be good to move it out of directly the government's hands and into a nonprofit sector. I think for friendliness and credibility, maybe also. I mean, we're the government, sometimes people don't like that fact. But my question is, what do other communities do? Winter is a seasonal phenomenon across the United States. Did we look, and are other communities have that expanding emergency weather shelter capacity? And is that usually all government provided, or is it the indirect government support of a private entity? What usually happens, if anything usually happens?
That's a good question. We didn't do a robust analysis of other jurisdictions and what they were doing, but we did see kind of across other communities that there were a lot of faith-based organization-led efforts on the severe weather emergency shelter front. And I believe City of Spokane did a city-led effort, which I can get more details on and sent to Terry for circulation if there's interest there.
I guess the question is there consensus on the best approach, or no consensus really at this point?
I think there's certainly probably a set of best practices that are out there. And I think these best practices would probably outline, a really intentional planning process and kind of all of these different operational elements that I think make sense and have probably proven successful in other jurisdictions. So yeah, I think there's part of where we're at now is we are kind of debriefing internally from these severe weather interventions and seeing kind of what our chief takeaways were and what we did right, where there's opportunity to grow. And I think that this question around best practices is going to be kind of a key detail that's going to inform a lot of our future work and kind of help mold the framework that we have that we put in place.
Doug, you have a question.
Yeah, no, I had just a short statement to add to this. I think that it was asked like what can be done. We can talk about what's quote unquote best practices or not, but the fact is that people who are trapped out in the cold, if it's a severe weather event, or year round when it's not a severe weather event, the number of people who are actually on the streets or who are homeless is a finite number of people, and it can be, you can put a serious dent in it. And I think that you will always need severe weather shelters or whatever when the situation gets to that point. But if you have more and more of year round, where it's not just about everybody shuffling around right at the moment when a crisis hits, and then it's temporary for 2 months or 3 months, and then they go back out to where they are, where they were. If you had more that was year round, you would actually get that number of people who would be caught in a crisis when it gets cold or it gets too hot, would not hit the crisis point at all. And so I'm not saying that you can ever really get rid of it, but like, you know, thinking of it of more year-round options for people prevents the emergency from occurring in the first place. So that's the only thing I wanted to add to that, and I'll leave the rest to you guys.
Thanks for that, Doug. There's another question about why does it have to get so cold before we open? Can we open it when it's not so cold? And I know that this has been a topic that has been discussed quite a bit by local government. And I was not involved in that process to arrive at that number. What is it, 28 degrees to open? I wonder, Katie, if you can, or even Chris can speak to.
And one thing I wanted to add, sorry, because you responded to what I just said, is that if you had more year-round options as a normal option, then you could perhaps raise that level of degrees. You could raise it to 32 degrees or 33 or 34 degrees, because the pool of people that need it when a severe weather event happens would be smaller, and the amount of money required to cover it at a higher temperature would be available. And so that, I don't know, that's my thoughts. Sorry, but I don't mean to interrupt. Bye.
Yeah, I can chime in real quick. And thanks, Doug. You're absolutely right. You bring up a really important piece of this equation. I was kind of on the sidelines a few years ago when that discussion took place. And there were folks arguing for, 50 degrees or 55 degrees if it's raining outside. We looked at other jurisdictions around the country, and some of them are more in the 20, 15 degree range. So there's a huge range of responses, but ultimately it comes down to how many nights are we going to be open? So we had 28 degrees kind of as a compromise that nobody really liked. This last winter, that meant 8 nights of operations. The lower that number, the fewer the nights, the higher the number, the more nights there are. And that's based on how many people are we going to serve and how much is it going to cost to do that. So as you raise that temperature, you raise the price tag, and you factor in these other things like Doug was saying. If you have more units of emergency shelter around the calendar, then there's less of a need during the winter to add extra capacity. So all those things are factored into it. I'm not going to say that I have any answers as to where it should be set, but those are the kinds of considerations that are behind those numbers.
Thanks, Chris. I appreciate that explanation. What do I want to say here? I made notes. I do know what I want to say. I want to acknowledge, it's difficult to attract volunteers on a moment's notice who are perfectly trained. And it's difficult to do that in a day warming center, right? But to do that overnight temporarily is even more difficult. And something that Bridget Reeves from the mission shared with us in our small group of discussing this is that the more complex the need, the more difficult it is to attract volunteers and attract qualified volunteers. So it's a little easier during the day to look to nonprofits, right? Because we're all working during the day. Really tough to ask a nonprofit employing people working 9 to 5 to then work 5 to 9. And so that brings us to our challenge. And this is not going to be a surprise to anybody. We struggle with this every year, locating an operator. So one thing we discussed as a smaller group was how can we support the county or the city's efforts to attract an operator? Because when we looked around the room, we all have a lot of skills and expertise. And maybe we can do things that would prevent an organization, maybe a smaller organization that could do overnight, to kind of get over those hurdles of recruiting volunteers, locating training, figuring out how to do an RFP, figuring out how to write an operating plan, what kind of forms do you need? And so we were thinking of, why don't we assemble something kind of like a companion guide to an RFP to kind of ease the lift. So it's not just the city or the county saying, come on out, apply, but it's us as a community saying, we have this need, and here's how we can support you. So to that end, I'm going to put a link in the chat. It's a Survey Monkey. Chat, okay. And this is, I'm asking you to take a look and fill this out. SurveyMonkey says it only takes 2 minutes, but really what we're soliciting is, what do you have? What can you offer? What would you provide to something that could really support anyone who's interested in applying, that we as a community can support that operator? So I would love to get a lot of information from that, bring it back to this group, synthesize it, take the expertise we have, and potentially figure out how we can do this better. And I also challenge you to think beyond this winter. We have to get out of this cycle of, oh God, it's winter. Winter happens every year, right? Let's think about ongoing, what can we do to provide this support in the long run? And this comes with a commitment, probably on steering, but man, I open up to anyone who wants to help this, because there's a maintenance aspect to this too. We can't just put together a guide and then leave it alone and expect it to be accurate next winter. So this is something we're going to have to revisit as a group to try to resolve this problem, because the cities and counties are not experts in homeless services. It's like asking the hospital administrator to take out your appendix. You don't want that. You want the hospital to hire a doctor. And that's really what our local governments are saying. They're saying, we're not the doctor. Can a doctor come in here, please? Here's some money. So that's my pitch to you all. Please do the monkey, survey monkey. And that's kind of all I had to say about that, but it looks like Doug has his hand up.
Yeah, I don't want to take up too much time or anything, but you mentioned, like, how do you get volunteers to work during the hours that aren't normal workday stuff? Okay, so this goes back to like how we operate as Homes Now. Homes Now is an all volunteer organization. We have no paid staff. We manage 2 villages and we house around 50 people. And we have no paid staff. We're on a shoestring budget at all times. Now, one of the ways you can fill this gap and you can actually get it to be a 24/7 operation is if there are people who need to be served, who are competent enough to act in a staff capacity in order to actually keep something operating on a 24/7 basis. And if you have to rely on volunteers who have a normal job or whatever, you can only rely on them at certain times at certain places, and you can't actually get a schedule together very easily or anything. But if somebody needs the shelter and they are able to help operate the place, you can create a stable situation that lasts for years or more, without any money or without any, we need money and everybody needs money, but like without having to pay staff on a daily basis, and stable enough to where you're going to be much more stable than if you're in a tent or in the woods or whatever. And so that's all I wanted to add, that if the city or anybody, they're not experts in it, but if somebody who's been homeless, they're an expert in it. They've been homeless. They know what it's like and what they have to deal with. And so our main volunteers are people who are homeless that live there. And judge it how you will, one way or the other, but I think that there's some avenue for that, for preventing the emergency from occurring, because a situation is stable enough and people that are in that position and a low income situation, extremely low income situation, are able to capably manage it. Of course, problems still occur, but yeah.
Thanks, Doug. And before I go to Michael, I want to catch this question that Vaughn asked. Is an operator strictly defined by a registered nonprofit or private entity? I think, and Chris and Katie, help me here. The operator needs to be an entity that can take legal responsibility. So you need to carry insurance, right, to protect the people that you're serving. And something that a lot of folks don't understand about city and county and other government contracts is they're frequently on a reimbursement basis. So you have to have some money to pay for your expenses and then invoice. So anyone who has capacity to do that and to sign as a legal entity to be responsible, I think would be an operator. Was that a fair description, Chris and Katie?
Yeah, that's pretty good. I mean, we're looking for nonprofit agencies, people that are licensed and registered and insured, as you said, Terry.
Thanks. Michael.
I'm just going to brainstorm a bit. I've been thinking about all the time about how do we get new partners? How do we grow partners from the ground up? Familiar with the Sea Feast? The Sea Feast is this celebration out the waterfront of fishing and food and waterfront culture. That was propped up, created with funding from the city using tourism support dollars. And what we had done in the past is say, hey, anybody got a legally eligible tourist event, apply to a grant, we'll help you fund it. But we did in that case is we held back money. So we had a big pile of it and said, we're going to instead use this as seed money. And it was like $75,000 a year. And then it was like 75, 75, 50. The idea is that we would give you like a 3-year startup grant and you would come up with a community event. So Sea Feast is no longer funded by the city, right? It was started with a startup grant. Would a startup grant idea work for standing up a nonprofit? With the idea being that it's not perpetual support, but it's like startup grant money, 3 years money. How do nonprofits emerge that are going to be enduring and that they can staff up and train people? And, you know, is a startup grant a good idea? You don't have to answer now.
I could chime in if I don't know if Terry, you want to respond. I just, as a recently started nonprofit, what I can say is I think 3 years is a good timeline to be looking at. You're talking about recruiting, training, developing policies. And so I would say that if there was also some sort of like added support, or like if there was some type of nonprofit startup like plan or something, like these are the steps, these are something to help, because the unfortunate thing about nonprofits that I'm learning is through some of my peer groups is that nobody really knows how to do it. They just like start and then they learn as they go. And so having somebody with seed money start with their best foot forward, I think would also be best served if there was some sort of plan and or something to help them get started in regards to how nonprofits are structured and organized and all the things that are needed. So that would just be my 2 cents, is that piece would probably be helpful to go with it.
I would just say just all of that, Ashley, but I would say what Michael's identified, that's the rub, right? The reason that we keep looking to the same nonprofits, and usually larger, is because they have multiple funding streams. So they can float that expense until they can invoice. That is real tough when you're a small startup. So I don't know how to get over that barrier. I leave that to our administrators in the group, but that's kind of the thinking I had behind creating this resource guide. Like, we don't have money, but we have a lot of brains and a lot of skills. We could probably collectively put that together to support any small nonprofit that's trying to make a go of it and to fill this role. Before we go to Doug, and I'm mindful of time because we have a couple of updates still before we get to the end of the meeting here, but Dina says, it seems that one of the challenges this winter with volunteers, at least with the county's warming shelter, because of the ad hoc nature, was that many volunteers were lined up and then called off shifts. So a question would be, how could the centers be reliably planned so that volunteers would have a stronger assurance that their services would be needed and used? And that's a little bit of a fortune teller question. Needing to know how many people show up, how much space do we have to offer, when is it going to happen, how much time are we going to ask people to volunteer? And we don't know that because we can't predict the weather. So that's my off the hip reaction, but if anyone else wants to chime in, go ahead. And then I'll also leave it. I think, Doug, do you have another question?
No, it's moved on. I'm good.
Okay. And then Michael, did you have something to add? Okay. Hands up. All right. If it's cool, I would like to move on to the next point on the agenda because I want to be respectful of time here. And that's an update from the city, but I kind of feel like we kind of got one from Katie already.
I actually have a couple and I can breeze through them really, really quickly. But I'm going to ask for this group's help. So the first update I want to provide is on the draft home ARP allocation plan that we at the city have been working on. And we recently published online for public comment. So just a little bit of background. The American Rescue Plan Act of 2021, signed into law in March 2021, was intended to provide relief to communities, individuals, businesses that have been affected by the COVID-19 pandemic. Congress appropriated $5 billion of this funding to address the needs specifically of individuals experiencing homelessness and other qualifying vulnerable populations through housing, supportive services, and emergency shelter. This funding is allocated by formula to jurisdictions, and it's anticipated that the city of Bellingham is going to get about $2 million in this funding. In order to receive our funding, however, we are required to develop a home ARP allocation plan, and community stakeholder consultation and public participation is essential in the development of this plan. So I want to announce to you all that our draft plan has been published and is now open for public comment. The public comment period for the city's draft home ARP allocation plan is going to remain open until Monday, April 18th, 2022. And I will share a link to the draft plan in the chat. And I invite all of you to read the draft plan and submit any comments that you may have to either myself, which I'll also put my email in the chat, or to the general community development email, which I can put in the chat as well. Additionally, we're going to hold a public hearing to discuss the draft plan on Thursday, April 14th, as part of our regularly held Community Development Advisory Board meetings. The purpose of the public hearing will be to take public comment on the draft plan, which, as I describes the activities that we're hoping to fund and qualifying populations we're hoping to target with this $2 million in funding. So I'll post that in the chat. And then my last update is I wanted to provide an update to this group on the Downtown Ambassadors Program, because it will be this program, which I think I brought to this group before, is going to be starting very soon within the next couple of weeks. They've posted the job notices for this Downtown Ambassadorship Program, and it's gotten a pretty healthy response so far. I think they've gotten upwards of about 50 applications and they've had interviews. I think the plan right now is for hiring to be taking place soon. So I know there's been a lot of community questions on this program, and I think in response to this community interest, the managers of this new program wanted to make themselves available to introduce themselves to the public and answer any questions that the public may have. So I want to kind of share with this group that there will be an opportunity for folks to learn more about this, this program and other initiatives that are happening downtown at an information night, which will be held the evening of April 21st. And it's going to be hosted by the Downtown Bellingham Partnership, and it's going to be hosted at the Boundary Bay Brewery Garden. And it's going to feature representatives from various downtown programs, including this Downtown Ambassador Program, as well as some other kind of different downtown programs, a graffiti cleanup initiative that's going to start, and folks from the Downtown Bellingham Partnership will be there. So I don't have a flyer for this event, but I do have a link to the Facebook event. So I'll share that in the chat. And I invite anyone who's interested in attending to RSVP, and feel free to attend and ask any questions that you may have.
Thanks, Katie. And Bob Kumar from HOT and I are planning to be there to talk to anyone who's interested to learn more about HOT and how we're going to be interacting with the Downtown Ambassador Program. Chris, I kind of stole your thunder with the RFP, but do you want to give an update for the county?
I actually don't have a whole lot to add, and that thunder is shared anytime, Terry. So yes, that RFP is expected to be out on April 20th. So look for that. I think it'll come out through the Whatcom County finance section of our website, and maybe Terry, you or your staff could send out a link to that through this listserv. We do have some other RFPs coming out as well. There's a site-based behavioral health services RFP, a community leasing program RFP, and then on a really related and relevant note, an annual emergency shelter and interim housing RFP as well. So to Doug's point, that's, the severe weather is a piece of this. It's connected to our other sheltering resources, which in turn are connected to our other more permanent housing resources. So there's actually movement throughout the continuum. So stay tuned for more on those. But this first one, looking for an operator for winter shelter, will be the first out here in a few weeks. The others will follow later in the summer. Thanks.
Thanks, Chris. I'll try to make this quick. An update from the service center. I've got a staffing update. We've had a wild several months of staff turnover, but I'm really happy that Liz Nyberg, manager of the Homeless Service Center, has staffed up coordinated entry. So 2 folks started this week, so thrilled to have them aboard. Another starting next week, but we still have positions that we're recruiting for. One you might see on our website or on Craigslist is called the motel coordinator, but that after some discussion, we realized that's really a misnomer. That's not really the job. The job we're looking to recruit for is a family shelter specialist. I think I got that right. And we're also recruiting for a landlord liaison. So the family shelter specialist, that's open until filled. So please share that information far and wide. We really would love to get someone great in this job. And the landlord liaison position closes on the 14th. So it's another week for folks to get their applications in. And there are a lot of us that are recruiting for employees. And a great way to keep abreast of that is to take a look at the Community Resource Network. And this is operated by Opportunity Council's Community Resource Center. I'm going to put a link in the chat to it because you can see all of the newsletters there and you can sign up to receive those newsletters and incorporate it into that. They usually have other agencies, including Opportunity Council, that are recruiting for positions. So love to get that information out as much as possible. Real quick, on the Way Station is a partnership that's underway between Opportunity Council, Unity Care Northwest, Peace Health, and Whatcom County. And that's going to be at the building that the Whatcom County Health Department occupies now on State Street. Will be converted to kind of day services for hygiene and healthcare. So that's Unity Care for showers and laundry and that kind of thing. And then the other side will be respite care for people who are experiencing homelessness and have nowhere to go, but they need more support after leaving the hospital. So the permits were approved and we're working on our operations plan. And then my last update super fast is the point in time count. And I know everybody's interested for those numbers. Are they different? We had, the date is actually not selected by us. It's selected and we all have to kind of follow that date. Well, the Department of Commerce changed the date and I'm kind of appreciative of that because it coincided with the height of the Omicron surge. So I'm really glad that we didn't have to have folks in the field surveying people, but even so, we still are in the pandemic and not fully recruiting for volunteers as we have in the past. But we have performed a count, we did an unsheltered count, and we expect that we may not have a draft of the report even until May because of that delay. That's all my updates. And it looks like Vaughn has a comment or a question. Go ahead, Vaughn.
Okay, let me know if this is too far into the vortex, but if I may, back to the thought about operators. I was thinking one of my difficulties with like trying to figure out how to start a nonprofit is just there's just, you got to have your board and your bylaws and all this, and then trying to find something more flexible like a limited liability company. So for example, I just want to know if there's a heck no or a heck yes, keep going with this. Like, what if there were a bunch of, say, AmeriCorps alumni or something, and we all have our basic CPR first aid, and then we go on to Niche Academy and get all trained up, and then we're ready and we're set, and then we're like, okay, for next winter, then we got to just make sure that we're insured, and that way maybe we're not insured year round, but we can get insured when necessary, because then we have our medical training and that kind of thing. And that would give more flexibility to people and not be tied into not be like, oh, this nonprofit is my full-time job, like this is my limited liability company that I'm a part of, and it fits into the rest of my life and my day job and all that. So am I making sense? And should I like explore more of this limited liability company kind of a thing, like a middle person operator?
If this is a bad idea, stop me, but I want to say yes, yes, yes. Explore that. And just anecdotally, I have an LLC myself, and when we first started operating one, I used to make a joke that we were a nonprofit because we weren't making any money. So just because you have an LLC doesn't mean that you have to earn a profit. If you do this for the purpose of contracting with the government to provide this much needed service, I feel like that could potentially work. Am I crazy? Michael says I'm crazy.
No, you're not crazy. But so incorporation is a legal mechanism to create an entity so that the entity can act, can contract, can hire. A nonprofit corporation is an entity. A for-profit corporation entity. A city is a municipal corporation. An LLC is a limited liability corporation, which is its primary means there is, as it says, to protect the owners from legal exposure due to business failure. I think the key is you just need to incorporate to make an entity which isn't the people, right? That the nonprofit has a board or has members or whatever, but it's the group that's responsible, and the group lives on, and the group is, immortal or long lasting, and it out survives the people who come and go. So LLC, nonprofit corporation. The hard part about a nonprofit is if you want to be a 501c3 IRS approved nonprofit, but you can just incorporate as a nonprofit and not get 501c3 status. There's nothing wrong with a non-IRS approved nonprofit. You just accept, well, there is in the sense that people can't write off their donations to you. But creating an entity, creating a corporation is important because it survives the people.
Yvonne, I
Okay,
just want you to check the chat because Chris put some definitions of eligible applicants in there. Thanks for that, Michael. I appreciate it.
So,
Well-
so just to see, like to clarify, just to make sure I'm kind of getting this. So then an LLC could still get donations, but people who donate wouldn't get a tax write-off on it. But an LLC could still get donations and would still be eligible for the grant, as Chris said. And then I like the idea of like the immortal LLC that can carry on even though people leave, and therefore like if someone can devote themselves for 5 years to it, and then go, they can, and the entity lives on.
And you can nest these. You can put qualified nonprofit inside an LLC, and then only one portion runs tax-free and the other is taxable.
Fun. I like the way you're
are, yeah, and I hope these respondents are filling out the survey monkey you made there, Terry.
Yeah. I know we've ran over, and I'm sorry for that, but I just am really appreciative of this discussion. I'm kind of energized by it, so thank you. At the end of our agenda here, there's some time for public comment. So if anyone wants to say something, now's the time. We have about 5 minutes for that. All right. Hearing nothing. Thanks again, everyone, for joining. Our next meeting is going to be, oh, I did not put the right date on here. It's going to be in June. Let me just look at my calendar briefly. It's the first Thursday, June the 2nd, same time. And we'll send an agenda out beforehand, and looking forward to seeing you all there. And I can't wait to read the results of that Survey Monkey. Thanks so much. Take care, everybody.